This is myth for an or regular patient of your clinic is complaining of pain and swelling through his upper left back plate. We remove his badly weakened upper left first molar on Tuesday morning, and it is Friday afternoon now, and he is here on an emergency hour. The pain started 2 days after the tooth was removed. He is also experiencing bad breath. Medical history indicates he is allergic to penicillin. He does not smoke or drink alcohol. You are suspecting that he has a post-surgical infection. Address the patient's concerns, explain what has happened, the necessary investigations, and manage the patient's condition.
The pointers here would be reconfirm symptoms after treatment and also emphasize on compliance with the post-op instructions. Focus on the medical history to rule out any causes which may have led to this post-op infection and focus on emergency management. Let's dive into the role play now. Hi, Miss Smith. Welcome back to the surgery. Are you okay?
You see, I'm having this very loudest and I'm having time to cover my mouth while speaking because I feel a bit smelly.
All right. Yes.
Slowly, but actually, like I'm smelling something foul.
Right. Okay. So how long have you been noticing this from?
I think from from the hospital, like Sancho was done, and then I started healed.
Right. And are you in any sort of pain right now?
Yes, there's definitely pain, you're...
Yes. And it's you reckon it is the area where we had taken the tooth out?
Yes.
Yes. Okay. And how do you feel right now? Do you have any fever?
Oh, no. Oh, I don't have any fever. I'll check.
Yeah. You do appear a little bit slightly swollen on the side where we've taken the tooth out. Let's have a look anyway. Now, I just also want to reconfirm with you, just recapping, what medical problems do you have? Any medications that you were on previously?
Oh, no. I just took some for the pain now.
Yes.
Nothing as such.
Has that helped?
A little, maybe just a little, not much. I'm still in pain.
Right. Okay. Also, just wanting to check with you, did you follow all the instructions that we had given you, after having the tooth out?
Yes.
So just wanting to know that, did you make sure that you did not take the gauze out for the first half an hour and no rinsing and spitting for 24 hours? Did you follow that?
Yes, I remember the spit time room and we had juices with this I didn't want to eat and take things like that. And I was a little scared, so I kept the got a little up.
Right. Okay. What sort of cleaning procedure were you following after we finished with the tooth removal?
So initially I couldn't really open my mouth to brush, so I was rinsing after every meal. But then
Rinsing after every meal, was it 24 hours after that we had taken the tooth out, or?
yes, because initially I only had juices.
Okay.
So I didn't really do anything for me. I didn't really do anything.
Right.
And then once I started on soft food, I started rinsing the water.
Okay. Okay. And were you able to use a soft brush and just brush around that area, or?
Not really. I haven't brushed because it's really paining. I'm not able to open my mouth completely, so I've only been only rinsing.
Okay. And what about, did you take any other medications, anything else right after this?
No, just a painkiller for.
Okay. So yeah, it definitely sounds like there could be a little bit of an infection after taking the tooth out. Just as we had discussed when we was discussing the risks and complications associated with taking the teeth out. Anytime we do them, sometimes they can lead to this sort of infection. But I will also do an X-ray today just to check and make sure that there's nothing there which is leading to this infection. Is that all right with you?
Yes, anything to help me.
Yes, absolutely. Now, what we need to do today is I will first have a look at the area. I will drain any pus that's present around that area and just gently clean it out with a little bit of salt water, saline water that is. And once we finish that, I also need you to follow the same oral hygiene protocols that we discussed last time after having the tooth out. So just make sure that you're using a non-alcoholic mouthwash just to keep that area refreshed brushed a little bit, just using a soft bristle brush, and in with the salt water is good, but just make sure that you are not disturbing the area too much.
Okay.
It's very important that we keep the area clean. So even a little bit of food there can trigger an infection response.
Okay.
Is that clear so far?
Yes.
Yes. So once we do that, I will also very likely I will be having to give you antibiotics today. So the antibiotics would be clindamycin, which would be 3 times for 5 days, because I understand from your medical history you are allergic to penicillin. Is that right?
I hope this is not the same medicine. Blood capsules.
No, so this is a different medication, and this is usually given to people who have allergies to penicillin. So this would be more effective in that case. Now, if after whatever we have done today, if for whatever reason you have not had any alleviation of your symptoms, and you've started to notice that it's getting worse, the pain's worse, you're unable to swallow, you're unable to open your mouth, or you have fever, and then if you feel like, yes, this is only just getting worse, then you will have to go and see an emergency department if this happens over the weekend or after hours. All right.
Why do you think this has happened? Because I followed everything in a table that when they rule.
That's a very good question. So sometimes some people can be susceptible to infections regardless of how well they have complied with the instructions. Some people have susceptibility to this sort of infections, and some people, that's the reason why I was asking you, just recapping your medical history as well. If you have diabetes or any other diseases that can reduce your immunity a little bit, they are also susceptible to post-op infections.
Okay.
And like I said, even a little bit of food or a little bit of a foreign material left around the area while the tooth socket is healing can sometimes generate an infection response.
Should I go back to my GP to check this?
It's a good idea to keep on top of that. Yeah, it's a good idea to always check and make sure that everything else is up to date. But these could be the reasons that can lead to this sort of an infection. Are there any other questions for me, Miss Smith?
Oh, no, I mean, I just thought that what we used today, to use something because I'm really not able to eat those things.
Yes,
Also,
absolutely. I completely understand your situation. And like I said, I'm always here to do my best to make sure that you will have a comfortable experience. So should we just go ahead now and do the X-ray?
yes.
And once we finish with that, I will go over the results with you, and then we will remove the pus from there, clean the area out, and then I'll write out the script. Does that sound like a plan?
Yes, it does.
Also, Miss Smith, once we've finished with the treatment that we've done today, I would like to review you again in the next week. Is that okay?
Yes.
So what we'll do is I will bring you back in, and I will then have a look at the healing once again, because I want to make sure that whatever we are doing is definitely helping in the healing process. Especially if this is an infection, we do definitely need to bring the infection down. Once that is good, and if I'm happy with the way it has healed, then we can just continue to monitor you. But if for whatever reason I'm not seeing much improvement, then I do have to consider referring you to see a specialist. Just to investigate further. Is that okay?
Yes, sure. I'll be.
All right. Perfect. Let's go ahead with the treatment then.